Well, hello everybody. This is Irv, and after a few emails and a couple of requests, um, I am doing almost a 2-year follow-up since the total knee replacement, and it is just before Christmas, 2017. And I guess I'll tell you where I'm at. I can honestly tell you that I am back to no pain. My range of motion is on extension, I am 0, and on flexion, I am 122 degrees. Now, this has come with a lot of work, and those guys right there are the big reason. The bicycles, the Aerodynes, have really got me to where I am right now. Not only riding forward, but riding backwards. Physical therapy obviously was a big thing, but continuing my own therapy after the regular physical therapist was finished with me helped regain all the strength in my muscle tone back. And the big exercises that I did besides the Aerodyne as I went down to the local YMCA, and I would climb the stairs. I would climb them backwards, climb up backwards, and climb down backwards. So it's, I don't say climb down backwards, but you go down the stairs backwards and you go up the stairs backwards. And that really works on the quad and really works on the hamstring, which were key for me to get my not only my tone back, but get the strength back in my leg. Um, Now, don't know really what else to say. Am I glad I had it done? In the long run, yes, I'm glad I've had it done. I would say that it has taken a year and a half total time for me to get to where I would consider that I've maxed out on my recovery. And the range of motion was the big thing. So all those that are looking at this, do your exercises, do your rehab, do your rehab, do your rehab, and stretch. I had when I was going to my physical therapist, which was actually at a local court, KORT. When it came to extension, I was only able to get about 6 to 9 degrees, and they taught my wife and my daughter how to do it. And between the two of them, we had about 200 pounds that would come, that when I came home, they would literally um, grab me right here, which is where they do at the physical therapy, and they would put all their weight on there trying to extend my knee. And that ultimately ended up doing it. And although I never felt any scar tissue popping or snapping, ultimately that's what got me down to where I was able to get 0 degrees out of it. The flexion was right there, and that's, yeah, there was pain, but that's what did it. The riding the bicycles is what got the knee to become 122 degrees. Anything else I can say? I don't know. It's not 100%. I guess my big drawback is I can't squat. It's kind of hard for me to garden, and I cannot kneel. I cannot put any weight on my knee, and any doctor will tell you that. And the weirdest sensation that I have ended up with is on the outside of the knee, and it's almost all come back except right here on the kneecap was totally numb. And obviously, they're severing nerves when they do the incision. Um, but I guess that's the lingering, my lingering complaint is not being able to kneel, not being able to squat, and then the odd sensation. And the odd sensation is only when I wear long pants like jeans, having them sit on top and on the skin there. It's a kind of a weird sensation, but it's good. The strength is there. I had last winter, I slipped on some ice out in the driveway and I hyperextended my knee. and the knee held. It actually didn't hyperextend. I mean, it felt like I hyperextended it, but structurally, I had it didn't give out, so the strength of it was there, and so all in all, I guess I'm happy. Um, and I think anybody who looks at this tell themselves, in the long run, it's going to be worth it. It's going to take a while to get to 100%. Now, not everybody is that case. Some people who are a little bit younger may heal a little bit quicker and have not had the physical been in the pain or the large incision that I had, were able to do their rehab a little bit quicker and not experience all the scar tissuing. But yeah, it's worth it. Um, it's almost 2018. I'm starting to get a little pain in this bad boy right now. So I'd say within about a year or so, we're going to be doing the other one, and I'm ready for that one. And again, I was in no pain on my left knee. I had just broken the last piece of cartilage that I had off, and so I experienced a lot of pain for a couple of days. My right knee's a little different. It's some long-term arthritis, and I know I'm bone on bone in there, so I got some pretty good pain going on in that one, and that's chronic. That's been long term. So anyway, I hope I answered all your questions. Continue with all the questions, and I will get back to you and answer you just as soon as possible. You take care. Have happy holidays.